Name is Shri. So let's begin our class. So first we will complete all the disorder and then we will go by case study one by one of each mental disorder. And after completing our session, we will take a look over small discussion for the query in last 10 minutes of today's session. So in last session, we were left at generalized anxiety disorder. Sir, 25th PPT open कर दीजिए.
Okay, ma'am. Okay, ma'am. Yes, ma'am. Anamika, ma'am.
नहीं सर, generalized anxiety disorder.
Okay, okay. General.
Yes, sir.
Yes.
Uh,
Okay.
the previous week.
Yeah.
हाँ जी. So, what is generalized anxiety disorder? So, in generalized anxiety disorder, generally characterized by various persistent excessive when we worry about various aspects of our life, like we worry about work, our health, our social interactions. So the this type of chronic anxiety often disproportionate to actual risk or impact of the situation. So individual that who are suffered with GAD generally experience symptoms like restlessness, fatigue, difficulty in concentrating, and like muscle tensions, and various type of sleep disturbances. So this anxiety is very difficult to control and interfere with our daily functioning and overall quality of life. So the exact cause of the GAD is not fully known. But the combination of like genetic, biological, or environmental factor may contribute various symptoms of generalized anxiety disorder. If we talk about the treatment of GAD, we often involve psychotherapy, particularly cognitive behavioral therapy, and various medications. In the these symptoms can interfere with our daily functioning and overall well-being. Uh, so next we will discuss about other mental disorder. Sir, अलग next slide कर दीजिए.
Yes, ma'am.
Yes, the other disorder is the neurodevelopmental disorder. When we talk about neurodevelopmental disorder in forensic psychology, it generally like autism or ADHD. It generally affect our cognitive and behavioral functioning from our early development. So, when the psychologist will scientifically evaluate these situations, these disorders influence the criminal behavior, intent, and legal competency. So, understanding their impact help determining appropriate legal responsibilities. So, if we talk about example of neurodevelopmental disorder, like there is autism spectral disorder (ASD), or other is intelligence disorder. So, the person who will suffer from the neurodevelopmental disorder generally facing difficulty in social interaction, the well-established communication challenges, their repetitive behavior and routines, or their restricted interest in any social communication. So, in forensic psychology, neurodevelopmental disorder like autism spectrum disorder and attention deficit hyperactivity disorder, named as ADHD, or intellectual disability generally influence an individual behavior, their legal competence, and criminal responsibility. So, the further evaluation can help determine the competency to stand trial, their criminal intent, and appropriate sentencing or treatment options. So, when we deeply understand the neurodevelopmental disorder, it is very crucial for ensuring fair legal process and effective interventions. So, in when we talk about further in the neurodevelopmental disorder, there is one disorder is autism spectrum disorder. What happens in autism spectrum disorder? It generally characterized by challenge in social communication, and a person feel very restricted. Their repetitive behavior or interest in any topics. Uh, when we talk about symptoms, in ASD, autism spectrum disorder, it often appears in early childhood and can range widely in severity. So, some individuals may also exhibit difficulties understanding social cues, forming relationship, or engaging in imaginative play. Other may have specific interest in engaging in repetitive actions like rocking or hand flapping, and etc. So, other disability in the neurodevelopmental disorder is the intellectual disability. In forensic psychology, the intellectual disability often referred as a condition where it characterized by below average intellectual functioning and very adaptive behavior deficits. Individuals who have been suffered with the intellectual disability typically have IQ below 70 and generally struggle with everyday tasks like communication, their self-care, their social interaction. These conditions in the intellectual disability generally originate before the age of 18 in any individual and can be developed due to various reasons like genetic, any environmental influence, or any prenatal factors. So, in psychology, intellectual disability generally assessed through cognitive testing, their adaptive behavior evaluation, and their developmental history. And interventions focus generally on enhancing the life skills and to provide the educational support to these type of individual and fostering social communication, social inclusions, and early diagnosis is very must and tailored support to those individual to enhancing the outcome and their quality of their life. And then we will discuss about other disorders. Sir, flip the next page. सर इससे नहीं इससे भी नेक्स्ट सर हो गया ये
हो
इसके
गया
अगला
मैम।
कर दो
ओके।
हाँ सर इसके
ओके
भी
सी
अगला
हो गया मैम।
हम्म, हम्म, सर अगला पेज कर दो
नेक्स्ट।
हाँ यस यस यस
यस।
the next is the dissociative disorder. When we talk about the dissociative disorder in forensic psychology, these disorders generally impact an individual behavior and their responsibility in criminal cases. These disorders involve a disconnection between a person thought, their identity, their consciousness, and their memory. So, the dissociative disorder are a group of mental health conditions that generally characterized by disruption in mental consciousness, their memory, their identity, or perception. These disorders generally develop as a coping mechanism in response to trauma or a stress that allow individual to detach from a painful experience or memories that an individual generally facing throughout their life. And when we talk about the dissociative disorder types, the first is a dissociative identity disorder. So, what happens in dissociative identity disorder? In this condition, generally people have developed a multiple personality disorder, which involve person experience two or more distinct personality states. So, when we talk the dissociative identity disorder in legal context, It might be used to explain erratic behavior or action that seem out of character. So, evaluator might need to determine if a defendant action were influenced by a different personality state, or these type of disorders generally have it within single individual. So next is the in dissociative disorder is the dissociative amnesia. What happened in dissociative amnesia? This disorder is generally characterized by inability to recall important personal information that usually related to any traumatic or any stressful event. So amnesia can be different type, like it can be localized, where the individual generally forgetting about specific event. It can be generalized, like individual forget one's entire life history, or it can also be a selective when individual typically forget specific aspect of an event. So, unlike regular forgetfulness, the memory loss is often sudden and can last for days, months, or even years in dissociative amnesia. So, in dissociative amnesia, typically involve memory loss that is more severe and ordinary forgetfulness and is not due to brain injury. And when we understand the dissociative amnesia in legal cases, it can be relevant in a defendant claim that have forgotten committing a crime due to these type of disorders. And within these dissociative disorder, there is other disorder like dissociative fugue. What happened in dissociative fugue? It often involves sudden and unexpected travel away from home, and the individual is very unable to recall one's past, and often with the assumption of new identity. It can complicate legal proceeding if a defendant cannot recall committing a crime due to fugue states. So, forensic psychologists, what do in these cases, will typically try to assess these disorder to determine the mental state of individual that often involved in any legal cases, which can affect their criminal responsibility, their competency to stand trial, and any sentencing type things. So, within these dissociative disorder, there is other depersonalization or derealization disorder. What happens in depersonalization disorder? Individual generally with this disorder experience persistent or recurrent feeling of detachment from their own body, or a sense of unreality regarding their surroundings. So these experience can be distressing and may feel like being an observer of one's own life. While the person feeling these type of feelings occur, these typically is in the response of stress or any type of the trauma, and they can also arose without an identifiable trigger factors. So, when we talk about the symptoms of dissociative disorder, it typically involve like severe trauma and their experience of physical or emotional abuse, or any personal neglect or witnessing violence can contribute these type of development, or high level of stress and anxiety and other mental health condition can increase the risk of dissociative disorder. And when we talk about the treatment of dissociative disorder, there is cognitive behavioral therapy, dialectical behavioral therapy, and other medications approaches. Uh, Sir, flip the next page. Yes सर हो गया ये. सर अगला पेज कर दो. इससे अगला. Yes, now we will discuss about the difference between the mental disorder and mental illness. So, when we talk about uh, mental disorder typically is a wide range of conditions that generally affect person thinking, their mood, their behavior, and functioning. Mental disorder are classically based on specific criteria or a diagnostic manuals. Like when we talk about the example of mental disorder, we already discussed like personality disorder, their anxiety disorder, mood disorder. And when we talk about mental illness is typically a broader term that encompasses any type of condition that generally affect person emotional, their psychological, or any social well-being. It generally not only to diagnose mental disorder, but also a condition that may not meet the full criteria for mental disorder, yet still cause the distress and impairment. That mental illness term can also evoke a more serious connotation, like often associated with chronic condition, like we need long care management and their treatment, like we have been suffer from depression, etc. So, when we talk about the key differences between the two, the mental disorder generally is having specific diagnosis, uh, have a very clear or defined criteria, like major depressive disorder, generalized anxiety disorder, as we have discussed before. And when we talk about mental illness, it is a broad spectrum of experience where individual experience mental disorder, emotional distress, and any psychological condition that generally impact the social well-being of impact that social well-being of individual daily life. And when we talk about the diagnosis of both mental disorder and mental illness, mental disorder generally diagnosed by qualified professional using various standardized assessment tools and criteria. And when we talk about diagnosis of mental illness, it not involve formal diagnosis. It can include range of experience like situational anxiety or temporary emotional distress, etc. And when we talk about the treatment of both, mental disorder treatment involves specific intervention, include like psychotherapy, medication, or combination of both. And when we need to diagnose or address the mental illness, we typically involve broader support system like various community resources. We need to develop stabilized lifestyle changes or need to develop a holistic approach, particularly for individuals who may not fit for specific diagnostic criteria. And when we talk about the example of both, the mental disorder example include like schizophrenia, bipolar disorder, obsessive compulsive disorder, generalized anxiety disorder, post-traumatic stress disorder. These are all are of mental disorder types. And when we talk about mental illness example, these are the conditions like situational depression, stress reactions, or an anxiety that may not qualify for a formal diagnosis but still affect a person's quality of life. And when we interconnectedly study about both the mental disorder and mental illness, the concept of mental disorder are both are connected. Many individuals diagnosed with a mental disorder will also experience element of mental illness. So, sometimes a person experience emotional or psychological distress may not meet the criteria for mental disorder, but still benefit from the supportive resources and interventions. So, to foster the any challenges people facing about the mental illness, society can work collectively to support their environment, to improve their social communication, etc. So, sir, flip the next page. Sir, next page, कर दो. Yes. Now we will discuss about substance-related and addictive disorder. In forensic psychology, substance-related and addictive disorder complicate a legal assessment by affecting judgment, their behavior, and their responsibility. So, in substance-related addictive disorder, there encompass a various range of conditions like related to use of harmful psychoactive substance like alcohol, any type of drug, any illicit injections that are commonly available in today market. There are many type of disorder within the substance-related addictive disorder, like we will discuss about alcohol use disorder. What happen in alcohol use disorder? There is an inability to control or stop drinking despite negative consequences. Individuals that are suffered with the alcohol use disorder may experience craving of alcohol. Their tolerance, they need more alcohol to achieve the same effect. Their withdrawal symptoms when not drinking. This disorder can often lead to impairment in their daily lives and can affect their relationship, work, and their physical conditions. And when we commonly discuss about the common symptoms of alcohol use disorder, There will be increase of consumption every time the people take these type of the alcohols and any type of the drug. And what can impact the alcohol use disorder? It often lead to a variety of health issues like develop of liver diseases, their cardiovascular problem, mental health disorder like depression and anxiety. And when we talk about socially, it can strain the relationship with family and friend, and often lead to legal or financial troubles. And when we talk about the treatment of AUD, it often involve therapy, need a supportive group, sometimes need a cognitive medication, and they need individual understand and change their drinking behavior, while support groups like Alcoholic Anonymous provide community and accountability. Medications like naltrexone or encoprosate can often be prescribed to reduce the craving and support recovery. Then we will discuss about other disorders. Sir, next page, Fazlul. Sir, next page, Fazlul. Mhm. So, other disorder is a sexual disorder. So, in forensic psychology, sexual disorder often involve condition affecting the individual sexual behavior and preferences. When we evaluate these disorders, require understanding their impact on legal and social behavior. Uh, it includes various potential risks to others. When we talk about the assessment of these type of disorder, it generally focus on intent and capacity for consent and treatment needs. It can affect both legal decision and therapeutic interventions. So they may include various type of sexual disorder like sexual dysfunction, where individual facing a difficulty in sexual response or experience sexual things, and there is a desire disorder in the within the sexual disorder, where the condition of hypoactive sexual desire disorder, where individual experience a lack of sexual interest or desire, and there is a, arousal disorder where or also called as erectile dysfunction, where individual is facing struggle to achieve sexual desire at a particular result, and there may be a other disorder within the sexual disorder is a pain disorder where a person or a we can also say the pain disorder in the vaginismus or dyspareunia. uh, what it means when the people have a fear of pain during any sexual intercourse. And there is other disorder like paraphilic disorder. What happen in paraphilic disorder? It involves intense sexual urge or behavior that are considered atypical and may cause distress or impairment. It generally include various type of disorder in paraphilic disorder, like one is exhibitionism. What happened in exhibitionism during pleasure from exposing oneself to other without consent. Uh, Other is the voyeurism, uh, when the individual gaining sexual pleasure from watching other engaging in sexual activity. There is a fetishistic disorder where becoming sexually aroused by non-living object, and there other is the pedophilic disorder where sexual attraction to pubescent children, which raise significant ethical and legal concern in POCSO Act as well. And there is other disorder in within the sexual disorder is gender dysphoria. What happened in gender dysphoria? It generally there is a disconnect between individual experience or expressed gender and sex assigned at birth. This often lead to significant distress, anxiety, and depression. When we talk about treatment of all of these, it often involves psychotherapy, hormone therapy, gender affirming surgery, or help individual align with their physical appearance with their gender identity. And when we talk about the treatment and support for the sexual disorder, their need of uh, addressing sexual dysfunctions like supportive group that provide a sense of community for those with the paraphilic disorder, open communication between partners, which is very crucial in managing these type of conditions. And sexual disorder can be affect sexual health and well-being. So, understanding these conditions is very vital for providing effective support and treatment that can ultimately promote a healthier sexual relationship and can improve further quality of their life. Sir, flip the next page. The other disorder is the confabulation. In forensic psychology, confabulation often involves fabricating or distorting memories without intent to deceive. That often due to cognitive impairment. It can impact legal cases by affecting witness credibility and accuracy of testimonies. What happens in confabulation? It is a psychological phenomena that often characterized by creation of false memories or distorted recollection that a person often without the intent to deceive. It commonly associated with the various neurological and psychological conditions, particularly those that have effect by memory and cognitive functions. In confabulation, individuals unconsciously produce detailed yet inaccurate narrative about their past experiences. This can include like a gap in the memory of the individual where the person fills in the blank with the fabricated or any altered information. Unlike line confabulation is not a deliberate act, individual generally believes in the truth of memories they are recounting. So there may be a various causes of confabulations, like person with having any large brain injury. Uh, it can also affect by dementia, and there is a Korsakoff syndrome. What happened in Korsakoff syndrome? It often involved with the chronic alcohol abuse and syndrome like memory loss that can also lead to a confabulation. And these disorder can also affect by their psychiatric disorder like schizophrenia or any severe mood disorders. When we talk about example of confabulation, there is we have listened about the Alzheimer disease. What happened in Alzheimer disease? They insisted they attend a family event that never have been happened, and they will describe about the detail and emotional tie to that false memory the individual cope up with. And in clinical setting, when a person diagnosed with the confabulation, patient recovering from a stroke might recount events like from past in a confused manner that generally blend true memories with the fictional element of any individual. So, understanding confabulation is very important in legal context and in the forensic psychology, as it can affect the interpersonal relationship and the individual self-perception about anything. And misleading narrative can also lead to misunderstanding or strained interaction with family or friend. Or it can also complicate the clinical assessment and treatment plans. When we talk about the treatment of confabulation, there we need to address and need to understand the underlying cause of the confabulation. So, confabulation is a very complex cognitive phenomena that illustrates the intricate memory of any individual. And confabulation can also enhance the empathy and support for individuals facing memory-related challenges and can facilitate better care and communication. Now we will discuss about other disorder. Sir, अगला पेज कर दो इससे अगला. The other disorder is somnambulism. What happened in somnambulism? In forensic psychology, the term somnambulism also called as sleepwalking. What happened in sleepwalking? It complicates legal cases as individual may act out during sleep without conscious intent or awareness. Evaluation must assess whether action during sleep or deliberate or involuntary can impact the criminal responsibility. In sleepwalking, it is disorder that generally characterized by complex behavior, whatever the individual is performing. It is a state of partial arousal from the deep sleep. This phenomena generally occur during non REM sleep and typically within the first few hours after the falling asleep. Or when person is within the deep sleep, these type of the phenomena generally occur during that phase. And These type of things generally more prevalent in the children, and it can also persist in adulthood in some cases as well. The individual experience somnambulism may exhibit range of behavior like including sitting up in bed. The person starts walking around the house or even leaving the home. Their eyes may be open, but they often appear glassy or unresponsive. The person with somnambulism, they typically do not recall these type of activity when they are waking, as their behavior occur during a sleep state rather than a full consciousness. Uh, Other is the when the person that are suffer from the somnambulism, generally impacting their routine tasks, and exact cause of the somnambulism are not fully understood yet, but several factors are that can influence the somnambulism, like there is a genetic factors like sleep deprivation. When there is a lack of adequate sleep, that can increase the likelihood of sleepwalking episodes. And there may be people can suffer from high anxiety and high stress, and these can also happen from due to particular medical conditions like sleep apnea, restless leg syndrome, or fever in children can also associated with somnambulism. And this can also due to effect of any particular substance use like alcohol or any type of illicit drugs as well. And when we talk about the diagnosis of the somnambulism, it can generally be diagnosed by physical examination, or can by like the psychologist will do sleep study, or that can recommend to monitor their brain activity, their heart rate, and breathing pattern during their sleep. And when we talk about the treatment of the somnambulism, most children outgrow sleepwalking. It often does not require treatment. However, for adult of those experience these type of episodes, they include like activity like improving their sleep hygiene to address the stress of these type of individual, and to develop the safety measures for these type of individuals. And there we will discuss other disorder. सर अगला पेज कर दो. Other is the dementia. As we have already discussed about the dementia in forensic psychology, the dementia can affect person cognitive functions, can impair judgment and memory. These can pose challenge in evaluating criminal responsibility. And when we focus on dementia, it can focus on extent of cognitive decline, their ability to understand legal proceeding, and capacity to participate in defense and decision making. They may include various type of symptoms like depression and anxiety, balancing in difficulties, and person will be in the delusion, and there many type of the memory alterations. सर अगला पेज कर दो. इससे अगला. Then there is a delirium. In forensic psychology, the delirium generally marked by acute confusion and cognitive disruption, and it generally impair an individual ability to understand or participate in legal proceedings. Persons that have been affected by the delirium can affect their criminal behavior. सर इससे अगला पेज कर दो. Then there is a hallucination. In forensic psychology, hallucination involve perceiving things that generally are not present and can impact person reality and behavior. So when the forensic psychologist evaluate the hallucination, it can affect the criminal actions intent and their mental state. Hallucinations are generally a sensory experience that appear real but are created by the mind, that can occur across all five senses and are typically classified into five main types. Like there may be a auditory hallucination. What happen in auditory hallucination? These are very common type of hallucination, where individual will hear the sound, voice, or music that generally are not present in their actual environment, and the voice that may speak directly to the person or talk among themselves. These type of conditions generally happen in those individuals that generally are suffer from the bipolar disorder, and a person with the major depression with the psychic features. And there may be other type of hallucination like visual hallucination. What happen in visual hallucination? The individual will see even those type of object, people, or light that generally are not present in the actual environment. And but in the visual hallucination, generally common in the delirium, dementia, and certain type of the drug intoxication cases. And other type of the hallucination is olfactory hallucination. In olfactory hallucination, person involves smelling odor that generally are not present, and the smells are unpleasant, like rotting food or burning rubber. And olfactory hallucination may be a sign of temporary lobe epilepsy or migraine or any brain tumor, etc. Then there is the other type of hallucination is gustatory hallucination that commonly involve tasting things that are not there and often strange or unpleasant flavor. These type of hallucinations generally occur in psychiatric condition or due to seizure activity in certain part of the brain. And there is other type of hallucination is that tactile hallucination, in which there involve typical feeling of the physical sensation like insect crawling on the skin, and when nothing is actually they can often occur on substance use disorder, particularly with the stimulant drug or in some neurological conditions. Or hallucination can also can be triggered by various type of the medication, sleep deprivation, or various extreme stress or trauma like cases, etc. Uh, when we talk about tactile hallucination, we have, as we have discussed, the person will feel the physical sensation about the insect crawling. It generally observed in the cases when people start consuming the cocaine drugs. And then we will discuss about other. Sir, next page कर सब पीपीटी विजिबल नहीं हो रही.
Hello. Hello.
हेलो
सब पीपीटी विजिबल नहीं है.
नहीं हो रही.
नहीं हो रही भाई.
हाँ, इससे नेक्स्ट पेज कर दो सर. इससे भी नेक्स्ट. इससे नेक्स्ट कर दो सर. Yes, then there we will discuss about illusion. What happened in the illusion? In illusion, it involves the misperception of the real stimuli that often lead to distorted interpretation of the reality. Uh, when we forensic psychologists will assess these type of the illusions, the illusions generally affect the behavior and decision making in the legal context. And in the understanding their impact on intent and awareness is very essential for determining the criminal responsibility. Then there is a rut disorder. Sir, अगला पेज कर दो. इससे अगला. Psychosis. In forensic psychology, psychosis typically involves severe mental disturbances like delusion and hallucination, as we have already discussed. So, it generally affects the reality perceptions. When we evaluate and assess the psychosis influence, it affect our behavior, our intent, and legal competency. And accurate assessment helps us determining the criminal responsibility. It is a mental state that is generally characterized by loss of contact with the reality that will result in significant disruption in thinking, perception, and behavior. People, those who have been suffered with the psychosis, may have delusion, means false belief, or hallucination, seeing or hearing things that are not present. And these type of symptoms can distort a person's sense of what is real and what is not present at that moment. So, psychosis can occur as a part of severe mental health condition like in the schizophrenia, in bipolar disorder, in severe depression cases, or any substance-induced psychotic disorder like when we use extra amount of alcohol in our daily uses. And it can also result from the any medical conditions like brain injury, any tumor or infection, or due to any type of overuses of any medication. So, onset of psychosis can be gradual or sudden and often involve uh, change in mood and thinking of an individual and the functioning of individual mind. And early symptoms will be of the psychosis will be the confusion, difficulty in concentrating, and the person will face withdrawal from the social activity, or person will be having very erratic behavior. And early intervention is very crucial in the psychosis cases as well. Then other term we will discuss about. सर इससे अगला पेज कर दो. Psychopathy. So when we discuss about psychopathy in forensic psychology, it is generally characterized by persistent antisocial behavior. Person will be having very lack of empathy, with very having manipulative trait. Uh, the person that will be psychopath generally have traits like criminal behavior, risk assessment, and various type of the treatment responses. So when we typically try to understand the psychopathy, it is very dangerousness or criminal responsibility and can develop the appropriate management or intervention strategies. There is a what happened in the psychopathy. It is a personality disorder. It is generally characterized by persistent antisocial behavior, where a person will be having lack of empathy. The person will be very remorse and very bold, very disinhibited and ego egotistical trait होंगी उसके अंदर. And one of the classical example when we will discuss about the psychopathy in the real world is the Ted Bundy case. What happened in the Ted Bundy case? He is very notorious serial killer. Ted Bundy display many characteristics typical of psychopathy. Bundy was very described as a charismatic or intelligent traits that generally used to manipulate people, particularly women, and gain their trust. And this he generally established their various type of the horrific crimes like murder, assault, kidnap, and rape of the numerous women. And Bundy often lured victim by putting the injury or pretending to need help. His ability to manipulate people was a hallmark of his psychopathetic nature. And Bundy action exemplify the dangerous potential of psychopathy when combined with very violent tendencies. However, not all the psychopaths engage in the criminal behavior, but many exhibit the trait in is more socially acceptable ways. So this is all about the psychopathy. सर इससे अगला पेज कर दो. Then we will discuss about सर इससे अगला पेज कर दो. इससे अगला. As we have already discussed about all of these disorder, what happened in the mood disorder and trauma and sensor stress related disorder. In mood disorder, in forensic psychology, mood disorder like depression and bipolar disorder, it impacts the emotional regulation and behavior. Uh, Forensic psychologists generally focus on the mood fluctuation that affect the criminal intent of any particular individual, their decision making, and their competency. Accurate assessment generally help in determining the legal responsibility of that individual, as the influence of the mood symptoms in the individual action and the need for treatment or the any legal accommodations. And then there is a trauma and stress related disorder. In forensic disorder, the trauma and stress related disorder influence the behavior and cognitive functioning after traumatic event. Example, when we discuss about example of the trauma stress related disorder, person generally experience or witness a traumatic event like military combat, any physical or sexual assault, any any natural disorder or any type of severe accident. And it can also include like we have been developed the intrusive memory, and person feel constantly on edge, that trouble feeling of that trouble in sleeping, and hyper vigilant to potential threats. And there may be also of the negative mood and cognition, where people will generally feel of the guilt, detachment from the other, and inability to experience any positive emotions as well. So next page, photo. And we have already discussed about the neurodevelopmental disorder. This is all about today's session. If anyone have any query about anything, you can ask. Amoli, Shrineha,
No doubt. No.
आपने केस स्टडी पे रिसर्च किया थोड़ा? हम्म। अमोली बताओ।
हेलो मैम।
हाँ जी, मैंने प्रीवियस सेशन में आपको कहा था कि केस स्टडी का थोड़ा देख के आना।
मैम एक दो केस स्टडीज देखी ज़रूर थी, बट मैम पूरे तरह से मैंने उसके लिए प्रिपेयर नहीं किया मैम।
कोई पर्टिकुलरली डिस्कस करना चाह रहे हो आप?
मैम नेक्स्ट टाइम है वो।
ऐसे सिंपल जो जितना भी पढ़ा है उतना बताओ।
मैम जो एक टेड बंडी वाला केस था, उसके बारे में था कि उसने जितने मर्डर्स किए थे, लेटर ऑन ही वाज लाइक कि उसने उसका एक पैटर्न था, हाउ ही डूइंग अ मर्डर्स ऑफ ऑल दोज पीपल, एंड मेनली वो फीमेल्स को टारगेट करता था। तो व्हेन ही एंटर इनटू द होम एंड हाउ ही इज डूइंग अ मर्डर, सो मैम वो चीज़ था मैम एक जो मैंने
हाँ, वो
रीड किया था।
साइकोपैथी में वो मैंने डिस्कस की है। हाँ हाँ।
जी मैम। मैम फिर उसने एट लास्ट ही कैन टेल दैट हाउ मेनी पीपल ही एक्चुअली किल्स। सो जब मैम उसका इंटेरोगेशन हुआ, सारा वो डिस्कशन उसका हो रहा था, तो वो यही चीज़ एक्सप्लेन किया उसने कि यस ही यूज्ड टू डू ऑल दोज थिंग्स, एंड अराउंड 90 और 90 से अबव पीपल को, गर्ल्स को ही एक्चुअली मर्डर्ड।
एग्जीक्यूट, यस यस। हाँ हाँ।
दोज थिंग्स मैम
श्री
हैड
में, हाँ हाँ हाँ। इसके अलावा और कोई है?
मैम एक वो देरी वाला केस था मैम, जिसमें मैम वो बच्चों को एज अ रिचुअल बेसिस पे किलिंग पे लेके, मतलब बच्चों को किडनैप करके उनको मारते थे मैम वो। तो उसका भी एक केस था मैम, नोएडा का केस था वो। सो दे आर द रिचुअल्स जो है मैम वो करते थे।
हम्म।
सो मैम
कौन सा?
इतना ही किया
हाँ, कौन सा केस है ये बताओ।
मैम। आई फॉरगॉट अबाउट इट मैम।
चलो कोई नहीं। श्री नेहा, आपने किया?
Ma'am, case, ma'am.
ओके,
I
बताओ।
I saw like I saw like two or three cases.
हाँ जी, यू कैन डिस्कस इट इन टुडे सेशन।
Ma'am, I read about the Jeffrey Dahmer one, and uh, where he actually he seduces males from bars, restaurants, and he brings them to his home. He kills them, and then he's a necrophilic. So yeah, he has sexual relationships with their dead body, and he then cuts them apart, and he's a cannibal, so he has them, but he keeps the skull along with them. So what he says is that it was he has abandonment issues. So he says that if he keeps the skull with them, it feels like he was never alone. So I saw that one, and uh, I forgot the other one.
चलो कोई नहीं इसके अलावा we will discuss more about the case study in the next session. And
Okay.
this is all about today's session. If anyone have other query, you can ask, or we can conclude this today's session. Okay, okay, okay. Good night, everyone.
Good night,
Good
friends.
night, ma'am.
Okay.